On Capitol Hill today, the curtain goes up on that long-awaited, long-debated House version of the health care reform plan. Let's get the latest on that from CBS News congressional correspondent Nancy Cordes. Nancy, good morning.
Russ, good morning to you. That's right. House Democrats set to unveil their major new health care reform bill after weeks of intense internal negotiations. CBS News has learned what some of the key provisions in that bill will be, and they include a hefty tax on the wealthiest Americans.
The surtax would only hit individuals who make more than $500,000 a year, or families making over $1 million. Those Americans would have to pay an extra 5.4% tax on income to help pay for reforms. What kinds of reforms? First, the creation of a government-run health insurance plan, the so-called public option that those who don't currently have insurance could buy into. Speaker Pelosi had wanted a powerful public option tied to Medicare rates, but she didn't have the votes. So instead, a scaled-back plan would have to negotiate its own rates with doctors and hospitals. The bill would also expand the Medicaid rolls from families earning up to 100% of the poverty line to families earning up to 150%. And the bill calls for an employer mandate, which would require companies with payrolls larger than $500,000 a year to offer their workers affordable insurance or pay the government a fee worth 8% of payroll.
There are still some controversial issues to be worked out, most notably whether any taxpayer dollars can be used to fund abortions. A group of conservative Democrats is threatening to block the bill unless a ban is written into it. Russ?
Nancy Cordes on Capitol Hill. Thank you very much.